Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyn Lambrecht.
Welcome to Conversations for Health. I'm Evelyn Lambrecht, and today I'm joined by Dr. Ina Melamed, pharmacist and functional medicine practitioner who specializes in Crohn's, colitis, hormone imbalances, chronic inflammation, and digestive dysfunction. Welcome to the show, Ina.
Thank you for having me. It's my pleasure.
I'm so excited to talk to you today. Dr. Ina is the founder of Digestive Reset, the author of 2 books, Crohn's and Colitis Fix and Digestive Reset, and a frequent contributor to professional education platforms. In this episode, we will talk about Dr. Ina's professional and personal journey and dive deep into inflammatory bowel disease. Ina, what's lighting you up this week?
It's just knowing that my clients were deprescribed medications. One of my clients went in full remission. In remission. In traditional world, that's a big accomplishment. In functional medicine and integrated world, we really take a pride because our contributions are indispensable.
I love that. That's amazing. And it's interesting hearing from somebody who is a pharmacist. So let's get into your background a little bit. I'd love for you to share your personal and professional journey, how you became a pharmacist, and then how you came to specialize in Crohn's and colitis.
Perfect. Yes, I'd love to share the story. I became a pharmacist for a reason that a lot of healthcare practitioners become healthcare practitioners. They see a loved one being sick, and from a young age. And in my story, it was my grandma. She was sick. What actually happened to her was probably IBD, Crohn's, that was not diagnosed as Crohn's at those times in Ukraine. It was called colitis. It was one big umbrella. Lots of surgeries, lots of issues. I've seen her walking into the pharmacies all the time. And in Europe, pharmacies smell with this herbal aroma. And this person in a white jacket was God, right? They were giving my grandma something that relieved her pain. So that, of course, stuck with me. And that's what I wanted to do since the young age. Later on in my story, being a pharmacist, seeing things a little different from the other side now, working behind the counter, seeing people coming back with prescriptions and need for more prescriptions. We now have this drug with side effects and more prescriptions for the side effects. It took a while for me. I still felt very satisfied because, yes, there's that aspect. When you give someone relief for pain and they feel better, how much better can that be? How much more satisfying as a healthcare practitioner? Your advice. I always believed in advice. I always thought, it's not just about dispensing. We were seen as pharmacists as just the dispensing role. It's never been. It's really, truly never been just the dispensing role. 100 years ago, people would go to a pharmacist who was everything. He was a doctor, he was a pharmacist, he was an herbalist, he or she. I think it's an important, very, very important role that can truly be that middle for a lot of healthcare practitioners. I believe in their role. But then I was taking back for a while, and then I got sick. When I got sick on medications, knowing all the side effects, I wanted to do more than just that. And in my story, the medication didn't truly relieve my problem, didn't take care of the problem. So maybe that was, in a way, how my journey took me to this route. I've done a lot of interesting things, and functional medicine was that final point that helped me recover. I believed in it from day one. I wrote about it on the website just as free information sharing. And my first client came to me this way. So that's how my functional medicine practice started over 15 years ago.
Thank you for sharing that. And I think that's the story for a lot of practitioners, right? Like, we find ourselves encountering difficulty, whether it's in ourselves or in a family member, and then dive down a rabbit hole and then, encounter functional medicine. So I would love to dive more into Crohn's and colitis, since you are specializing in those, and talk about, like, how do you approach someone with Crohn's or colitis? Who is the typical patient who comes to you? Let's start there.
I think it's a great question, because not everyone, of course, would be that perfect candidate for what I have to offer. My programs do require someone to have an open mind, to see that there's more than just the traditional medicine. I know that I can easily say who this program is not for. It's for those that just interested, give me the pill, and that's all I care about. Even with nutraceuticals, there are people that, I'm interested in integrative medicine. I'm interested in the functional medicine approach. Give me give me that vitamin, give me that supplement. So functional medicine and integrative medicine is more about your body as a whole, emotional, physical, toxins, a lot of aspects. It's a multifactorial root cause for Crohn's and colitis. So yes, it's definitely for those that understand and appreciate that there might be changes. You might have to address, or most likely will have to address, lifestyle changes, your sleep, your stress reduction techniques. In my programs, I have that as a whole module, stress reduction techniques alone. I know I'm not a practitioner of any of these stress reduction practices, yet I could share what worked for me as a coach, and I can definitely share even the words of affirmation or intention or tapping. I can share those that worked for me to heal my gut. So people that are interested in doing more than just give me the pill, interested in understanding more, people that are loving to go after the root cause, like, let's do more labs, let's find out maybe there is a possibility that I have something, a pathogen, bacteria, virus, candida, fungal infection that still wasn't found. I think it's incredibly important to find.
Yeah. So tell me about your typical patient who comes to you. What do they present with? And then where do you start from there?
So my clients, it could be a kid from 5 or 6 years old that the mother wants to do more for, to someone who's 9 years old that also wants to have a little more anti-inflammatory herbal support that is not available through their regular practitioner, or even anti-inflammatory support that they're concerned about. Maybe there is a drug interaction. Maybe there is therapeutic duplication. Maybe there's something there that not an expert wouldn't know. So it would be someone who is interested to go after the root causes, do the functional medicine diagnostic, go through a program that's been proven to work, step by step from nutrition to anti-inflammatory to toxicity and detoxing to figuring out what's going on those labs, and then good program that will take them from flare to hopefully remission.
I want to go back to something that you said. I haven't heard this term used before, therapeutic duplication, but it is something that we list like in our drug nutrient depletion and interaction checker, right? Because it could be considered a positive interaction at times, right? But it's also something to be cautious about. Like if you are taking metformin, but then you're also taking berberine or other blood sugar lowering nutrients, people need to be aware of that. So I'm curious if you could speak to the role of the pharmacist in this context. Like, when should people work with a pharmacist to uncover these? Or is it the role of the practitioner treating? Is it the role of the patient? I know some pharmacists also do not have the time to even spend on, maybe severe drug interactions, yes, but maybe not drug nutrient interactions. And I don't see depletions very often. Can you speak more to that?
Absolutely. It's incredibly important to catch those. And yes, in the pharmacy dispensing role, it's practically impossible to go and spend so much extra time to get that list of supplements that no one has, right? No one has that list. Only that patient client has it. The doctor will give them a prescription list. The pharmacist will receive that prescription list. That's it. What's in between is an incredibly gray area, what patient client has and taking. So I go through, there's such room for functional medicine pharmacists who are in between the doctor and the regular dispensing pharmacist, unless a pharmacy would offer a role to a functional medicine prescription of a pharmacist in that setting to spend that extra time, to go into the room, to spend the time to list those, to go through the checker and see. Do you know how many times I would catch 2-3 different supplements that have enormous amount of vitamin E, vitamin D? These are not water soluble vitamins. Vitamin D can go in incredibly high doses and can become a problem. Although a lot of us are depleted, but once it's really, really high, that's a problem too. Your body doesn't get rid of it right away. Vitamin E can cause bleeding in extremely high doses. I've seen multivitamin and then another blood sugar supporting supplement and then another energy supporting supplement that all had vitamin E in such doses. It took me a minute. Let me breathe. These are not to be combined together. We are really missing a lot of these patients. They're missing elderly. I have a great, amazing number of elderly patients, clients that are really into and they understand and they have a background, some of them in healthcare, and they still would miss and not know what they're taking. Someone who's a doctor, a retired doctor or veterinarian, these are educated people. We need those functional medicine pharmacists to sit down and figure out and check and make sure that duplication doesn't happen. It's not a joke.
Yeah. Do you think that if you were to go back into the pharmacy world, and you've worked in community pharmacy and I think you said Walgreens, right?
Rite Aid.
Rite Aid. Okay. So do you think that knowing what you know now, it would be possible to implement some of that? Because I think if pharmacists maybe just focused on, say, like the top 5 medications and their depletions, that could be a way. But do you think that you would have done it differently or would do it differently now if you were to go back to those settings?
An amazing question and really difficult to answer because when you're in the community setting with this load of prescription and really time constraining, and no computer system flagging, and no input of which other supplements are taken. You have no idea. Like I said, it's a major gray area. I would love to have the conversation with the patient / client, depending where I am. I would have loved to make that impact. It's just right now it's getting easier with the computer systems hopefully picking up on more things. When I started out in early 90s, late 80s, one of the pharmacists with the community setting was just switching from a typewriter.
Oh, wow.
So I came a long way. Things are definitely better today. Yeah, but yes, most community settings are still not there yet. There's room, there's place, and I'm hoping this is going to happen very soon.
Yeah, and I know there are programs now where it does flag potential depletions, so that's promising. And I'm sure with the use of AI, that'll continue to evolve, right? So let's talk a little bit more about Crohn's and colitis. So I'm curious, when a patient comes to you, I'm sure they've already done several labs. So I'm wondering, what are the additional labs that you do? Do you look at genetics? Do you just do a stool test? What serum markers are you looking at? Tell me more about your approach.
Right. I really like to see as a first marker to see where calprotectin is. Mm-hmm. And thankfully now it's also accepted by traditional world. When I started my practice, it still wasn't. When I was asking my clients to do a stool test that had calprotectin as a marker, traditional gastroenterologists still didn't do it. Thankfully, that's part of the practice today, which is great. It's an amazing marker to see flare to now remission or just improvement. Where did we go from this number to the other?
Is that both in Crohn's and colitis that calprotectin is like the number Correct. That you're looking for? Okay.
Correct. And it's for with that IBD umbrella. You do see different, with Crohn's, you see higher numbers on calprotectin often. With colitis, you see two common markers, a little lower calprotectin, higher than average, higher than normal, but lower than Crohn's often. But with ulcerative colitis, you constantly see occult blood in stool. With Crohn's, you don't often see that. But with colitis patients, you see that more often. And there are other things that obviously separate the two symptoms, right? The way you present, even with diarrhea, it's often different in colitis and Crohn's patients.
And then do you do genetic testing? Do you do other stool testing?
There are genetic testing that can be done for immediate relief. I always believe in quicker fixes, especially when someone comes in with pain, when they come in with diarrhea and severe fatigue. I am all about let's get to those quickly.
Yeah.
So genetic and genetic testing, they could be hit or miss. If you're familiar with Prometheus lab, so we don't do that much anymore. It was a big hit. Oh my goodness, we can now test between Crohn's and colitis or intermediate colitis and understand which one is this after that test. And with all these different data coming through and the change, right? Because originally it was one thing. As we pulled more data in, things were looking different. No one's even looking at the Prometheus lab anymore. It's more about presentation, symptoms, still how you're feeling. So I believe there will be more weight to the genetic testing, maybe a little later. We still have a lot to figure out. And with genetic testing, I'm also a little uncomfortable is when you could find the markers and genetic mutations, genetic changes, right? Snippets. but for majority of them, you can't do much about yet. Like with MTHFR, that's easy. We find the issue. You have both copies affected. We supplement you with a good methylfolate or hydroxy B12, depending who and where you are. And you're practically methylating as someone that doesn't have that problem. But that's just a handful of issues that we can fix like this. So doing genetic testing, will it do much for my kind of client, patient with Crohn's and colitis? It's not going to get me to quick fixes that I like. So stool test, yes. Hormone test, absolutely. Absolutely, because adrenals must be taken care of for someone with Crohn's and colitis. That's a given. That's inflammation. I often do micronutrient testing because most of my clients are depleted and unfortunately still not fully tested currently by the traditional world. Some physicians that are integrative physicians, they will do that, but a lot of it is still missing. I really do find some food sensitivity testing to be important. I know we were going back and forth on food sensitivity testing, whether it even has a room today, because if someone has a leaky gut, they will show up automatically with a lot. Because that's what's going on, right? All these foods are coming through abdominal cavity and they are showing up as affected and causing inflammation in the system. Your system's confused. Less leaky gut, less food sensitivity. So is there a point to do food sensitivity testing? Some practitioners today will say no, because first let's heal the leaky gut. I say many times yes, because if one food that's causing tremendous food sensitivity, like turkey that they're eating almost every day, let's remove that for now and reduce inflammation. So to me, that makes sense.
Yeah. And when you're doing stool testing, I'm curious, what are some of the interesting patterns that you see?
Yeah, we often see those two species, commensal bacteria, good bacteria, that are practically depleted in both Crohn's and colitis, Akkermansia and Akkermansia. Those are good guys. We need them in abundance. We need them to decrease inflammation. And we really want to make sure that they're there when the body is fighting another pathogen. If you're already depleted on these good soldiers that are fighting for you, you're not now in the worst case scenario. So I see, especially Akkermansia. With the studies, we've seen Akkermansia for, I've been researching this forever, probably over 10 years in research papers. Akkermansia depletions came up later, but now there's a lot more studies on it for many reasons. There's a company that's producing the supplementation. There's a lot of different factors, but they both equally important. Regrowing Akkermansia does change someone's state of disease, like from flare to remission.
Okay, so with the Prausnitzii and with the Akkermansia, we know I haven't seen Prausnitzii much like as a supplement, but Akkermansia definitely, yes, a lot more popular. And so I'm curious, in your practice, do you find that you see benefit when you use Akkermansia, just Akkermansia in your patients?
I definitely see Akkermansia making a difference for patients, clients, especially if you understand that it needs support of a prebiotic, of antioxidants like dry cranberries or blueberries or pomegranate seed. Some companies have that in a bottle put together as a perfect blend to give that great addition to help Akkermansia be in that gut microbiome grafted, stay there, not just help you for the meantime, which is great. That's wonderful that it's there to help you for the meantime. But our goal is to improve that gut microbiome for now, for later, for good. And those combinations together, whether it's a regular blend or a live blend of Akkermansia, it still needs the support of that wonderful prebiotic blend to stay in.
That's really interesting. So taking polyphenols with it is or necessary or helpful for the Akkermansia to stay. Okay, interesting.
That's that I think we're going to give a gift to people that are listening to this just by understanding that they need polyphenols on top of Akkermansia to actually make that difference in gut microbiome health.
And do you have patients take that at the same time, like literally take the supplement, or do you find that people can also get that benefit through diet?
Diet is great. Because I've done this for this long, I'm able to see the results, and I'm able to see what happens when someone takes Akkermansia alone. What happens when someone takes Akkermansia and eats well and adds the polyphenols regularly. I have clients that are amazing. They take stuff so seriously. They send me their food diary, pomegranate seeds Monday, Wednesday, Friday. They're that good. So I've seen if you are really good about taking polyphenols, you would also get a lot more benefit. Yet many people will not be doing those that much. So that's where polyphenol blend comes in. And I've seen the difference just the Akkermansia alone. For some, it will make a difference. For some, it will not. Then I would add polyphenol later.
Very interesting.
Then we hit the target.
And then those polyphenols obviously have so many other benefits beyond what we're talking about. So that's great. Any other supplements that you focus on? I know one of the big things that you told me you focus on is like digestion itself. And actually the patients or the clients who come to you, they are unable to digest their food. So do you use bitters? Do you use digestive enzymes? What are you usually looking at?
Yeah, one of the first things I start many, if not most of my clients, because they come in with digestive problems, are three things: enzymes, milk thistle for initial liver support, and L-glutamine to strain their lining. Those are the three minimal, bare basics to start. And that's what I teach my pharmacists that are taking my course in training. You want to start those kind of patients, clients with those three as a basic. Enzymes, milk thistle, and L-glutamine.
Okay, great.
Bitters can be great, but they're often not tolerated well for some. I've seen people without gallbladders that actually need bitters more than others, not doing well in bitters. They get nauseous. It can get too much for them. So I usually don't start with bitters. Bitter herbs are wonderful in the diet. If you want to get nutritionally involved with bitters, or even apple cider vinegar to help you with that acid production, fantastic. But bitters I usually hold if needed.
And with the digestive enzymes, I know that a lot of practitioners are fans of, starting patients with that. It can make a big difference for so many things and for nutrient absorption, which is a huge issue, like you talked about. Do you keep your clients on that for the long term, or do you find that it's, like a couple months and then they're actually making sufficient enzymes themselves, or no?
I think it's an amazing question, and we could have a conversation on that alone for hours. That is one of my favorite topics. It's not just digestion, though. When we talk about enzymatic insufficiency, pancreatic insufficiency, or now it's becoming a thing again. Forever, when I was discussing this with clients that took it back to their gastroenterologist practitioner, enzymes, that doesn't work. or no one needs it. Or if you need it at all, you need it in huge doses. So a lot of people with digestive problems, or at least chronic digestive problems, need it a lot in the beginning. Often as they get better, they need less of it. I've had clients completely off of them. I have clients that need to take them on as needed basis when they go out to eat, when they have a larger than average meal. The answer to your question would be, it really depends. I cannot name two the same clients that I recommend enzymes for. I really work with everyone individually. I personally take enzymes when I eat out.
But not with your daily meals, just when you eat out?
Most of the time, unless there's a season change. So I'm still a Crohn's patient, even though I'm in full remission, even though I'm doing incredibly well for close to 20 years now. I still have the genetics. I still have that predisposition, and I still cannot allow myself to go that way again. So I'm really careful. So if there's a season change and I know there's a higher now risk chance to get that flare, I'd be extra careful. I'd take more. I'll take it before dinner time if my dinner is later in the day. So because we produce enzymes practically according to the circadian rhythm. You do pump, just like the cortisol, right? You pump cortisol, a lot of that in the morning, a little less in the afternoon, and very little at night. That's how you're supposed to, if everything's going well. And the same with enzymes. Past 3-4 o'clock, not much is produced. So the fact that we're eating dinner, and dinner in this country is the largest meal of the day, the way we traditionally eat, it's wrong. It's completely wrong. Our breakfast should be the largest meal of the day for many reasons. For hormone balance, for digestive health. Breakfast is it.
And then I want to talk about the glutamine a little bit, going back to that. Do you just do like 5 grams of glutamine once a day, or are you a fan of using more for a period of time to kind of like get that inflammation down and strengthen their immune system?
I start everyone at about 3.5 grams to 5 grams as initial dose. Couple of reasons why. You do have people with anxiety that sometimes are sensitive to amino acids, including L-glutamine. So we watch. We start and we watch. If they're doing well with 3.5 grams to 5, and they're in severe flare, I really like to now crank up those doses, double, triple for a short period of time to help them make that lining stronger. And then you could start reducing the dose. It can be taken on daily basis. For someone with Crohn's and colitis, it should be considered as a daily routine supplementation, because the predisposition to the illness is not going away. You're born with it. You could handle it. You can reduce that flare. You can go completely in remission. Yet you want to just prevent. Preventative measures are often the best way. So this would be your prevention supplement.
Okay. I want to get into diet a little bit, and then also hormones. And I want to talk about a few more supplements too, actually. So to wrap up the supplements piece, do you find that there's anything, besides what we already talked about, that's, that gets you some great wins, especially in Crohn's and colitis? Just any supplements that like really get you a great win with patients when it comes to Crohn's and colitis?
With Crohn's and colitis patients, like I said, I start with those 3. I really like immunoglobulins for Crohn's patients. That has tremendous data. There's even prescription immunolin, right? The immunoglobulin supplementation. it does have great data. We've seen how it reduces inflammation and flares. Depending on each person, there's boswellia, curcumin for decreasing inflammation. It's a hit or miss because it could be irritating. So I could use those for people already that are doing much better. Just like have that last cherry on top of the cake, right? But first, you want to go gentle. Something that is tolerated better is butyrate compound. In the different forms, and liquid forms, and the pill form, depending it's a child or teenager, adult. There are adults that cannot swallow pills too. So butyrate is also very inflammatory and helpful for Crohn's and colitis people, especially colitis when they come in with a cold blood.
And with the butyrate, do you start with that as well? Like if somebody is in a flare, or is it something that you do after a period of time when you've worked through other things?
I usually start that for when I see a cold blood.
Okay. And how quickly do you find that starts working?
I typically retest if someone's in a flare at 3 to 6 months. So on the retest, most of the time there's no cold blood whatsoever. So I take it as a marker that it worked because we use it for that.
That's great. Yeah, I have a lot of practitioners who, in my area here in San Diego, who love using Butyrate. And we talk about it a lot on the podcast for various conditions. And I always think, okay, I got to take Butyrate too. There's always something new to try, but it's just wonderful that it's, even available as a supplement, especially for people who cannot, tolerate fiber for whatever reason, or as you're working toward incorporating more fiber in the diet. So yeah, very interesting information coming out on Butyrate.
And it's definitely easier on the gut than fiber supplementation.
Right.
My people, my Crohn's and colitis people, are having very hard time with fiber supplementation in any form, even in the most mild one like acacia, for example.
Interesting.
They're still having trouble. It came on the market, and it was great because, again, with Crohn's and colitis, people, you do want to give them immune system support. Immunoglobulins are there, but for example, colostrum, that's also something that would be ideally used as an anti-inflammatory immune system support, yet it's a dairy-based supplement. Then it's not for everyone, especially Crohn's and colitis. Many do not do well with dairy. So that has to be taken into consideration.
Yeah. So it's great to have the immunoglobulins that are serum bovine derived rather than a dairy source. Yeah. So since we talked about fiber, I want to get into diet a little bit more. I have two questions. One, are there certain dietary patterns that predispose people more to developing Crohn's and colitis? And two, what are your general recommendations for diet in your Crohn's and colitis patients?
Beautiful question. Again, at least an hour of conversation of what diets are usually tried. Many of my Crohn's and colitis clients come in and they already tried paleo, Mediterranean, fiber-free, special carbohydrate diet. The list goes on. What we've seen in the studies is that one worst culprit would be standard traditional American diet.
Right.
Because there's not a lot of vegetables, there's not a lot of good quality fiber, not a lot of good quality fat. We've been seeing changes. I'm thrilled that there is no more cereal that pyramid that we saw in the 80s, 90s, early 2000s. That was just serial killers, right? They were called. It was insane. That definitely tilted the numbers of Crohn's rise. If you're going to look carefully with that pyramid, we've seen the rise of inflammatory bowel disease, chronic inflammatory illnesses, and so forth, diabetes, with that pyramid. So standard traditional American diet, that is going to put you in a higher risk right there. And then And if you looking for that one diet to improve, and if I have to go through most of them and name just one, I would say Mediterranean would be top priority, although not everything on that list of Mediterranean diet goes well with Crohn's and colitis patients, especially things like eggplant, and that's like one of the staples, and eggplant is really irritating to a lot of my clients.
And with the Mediterranean diet, do you find it to be so helpful primarily because it is anti-inflammatory? And so it's getting those flares down?
It's a perfect blend of macronutrients, not micronutrients now. Macronutrients. You have your good fiber from vegetables, you have your quality fat, and you have plenty of good, clean, lean protein. So that's truly how anyone with pre-diabetes who wants to get out of that should be eating if they're looking to go the other way. Anyone with any inflammatory illness, including inflammatory bowel disease, that if you want to reverse, if you want to go the other way, stay within that macronutrient ratio, and you'll see that big difference. And that's what Mediterranean diet would offer.
Right. And then let's talk about hormones a bit. I know that you work on that quite a bit with your clients, and I'm curious, what are some of the correlations that you see? I know that you're a fan of the Dutch test. So what are some of the patterns that you see maybe in estrogen, testosterone, progesterone, estrogen metabolism that correlate with maybe gut testing that maybe like we don't usually think about?
Great question. And I spend a lot of time teaching my students in my school. Those are really intricate, very, very detailed things that if you learn well, you could be really helpful to people with these illnesses. Number one, methylation. So if you're having those higher, that estrogen dominance, often you have methylation issues and you need that support of methylation. Often with cortisol being depleted completely with inflammatory illnesses, inflammatory diseases, chronic inflammatory issues, not just IBD, not just Crohn's and colitis. You have to support adrenals. You have to support that cortisol. What I don't love to do is something that everyone's they're jumping on cortisol being high at night, because cortisol is not the bad guy. It's a good, cortisol is important. It's anti-inflammatory hormone. I don't like to reduce it. If I ever use supplementation to reduce nighttime cortisol, for example, to improve sleep, it has to be something that will not truly reduce the entire cortisol production. So adrenal support is important. Methylation support is important. What I see on Dutch test often markers for possibly depletions like organic acids. We see changes. A lot of Bs are affected. Crohn's and colitis, Bs, D is affected often. So a lot of these markers, again, that's a whole different conversation. But we do see a lot of help just looking at the markers on Dutch test and improving that hormone balance.
And is that one of the reasons? So prednisone is used quite a bit, right, in Crohn's and colitis. Can you talk about that link in this context?
Absolutely. So thankfully, it's used less now.
Okay.
It was used tremendously before biologics came, and I still have clients that are with me for many, many years that were really overusing prednisone that now have osteoporosis so bad from that, because it takes the calcium out. And the supplementation wasn't started on them early enough. That wasn't recognized then. Now it's gotten better. We use less of that, but it's still used. It's used plenty. And it does deplete and affects the bone. So yeah, a problem on its own. And when you use prednisone, if you do, for example, Dutch test, you'll see those cortisol levels are artificially high. It was that rise from the medication alone. So how true are those results? We have to take that into consideration. Testing someone after the medication, you have to give it time too. After you stop prednisone, give it good 30 days to see your true production of adrenals. So that has to be taken into consideration when someone comes into you right after the drug, on the drug, or waiting to see the true representation to do the test later.
So in regard to other medications like the biologics, to be truthful, I don't know a lot about them. I don't really know how they work. I don't know about side effects. Can you just share briefly like what we should know about biologics?
These are amazing drugs for those that are like, give me the pill. Remember we talked about that in the beginning. These are also incredible opportunity for kids, for example, that are in the growth spur age, and there is not much time to do what I do between the lifestyle changes and the sleep and the diet and something that takes a long time. My work is not an overnight success. There will be a success, no doubt, and long term for sure versus anything else. But it does take time. And this one will work faster. And if a mother, for example, comes in and contemplating starting a therapy, because a lot of people now are concerned studying that there's a lot of side effects on biologics. Effectiveness is nowhere near 100%. We know effectiveness is still questionable. But since they do work, and a kid needs to grow, and this is the time, there's no doubt that has to be started. Otherwise, lifestyle changes should be tried, and other things should be considered often. Interestingly enough, I do see that still nothing replaces nutritional approach. Even a recent study, 2024 study on biologics, we saw people taking biologics alone and taking biologics with poor diet, that they were depleted on selenium and vitamin D, those two. So poorer outcome was in those depleted nutritionally versus not. So nothing replaces the diet.
Right.
Drugs do not replace good diet. Yeah. If anyone's going to take anything out of our conversation today with the pharmacist, drugs do not replace good diet. It should be the key takeaway.
Yeah, absolutely. And with the hormone part, do you find that you need to do like direct hormone interventions, or do you find that when you lower the GI inflammation with the things that we talked about, that some of that hormone balance is restored just by working on the gut?
Amazing question. And it's a chicken or the egg situation. Hormone and gut, which one comes first? Every case is different for me. I do often, I was trained by Dr. Kalish, and his pyramid, his step-by-step was adrenals first always. And I do believe in that still. Yet with Crohn's and colitis, because we want to help them right away, we take reroutes. And one helps the other. So once you have someone on great hormone balancing program, that will reduce inflammation, and you will have the decrease of gut inflammation because of that. But if there is a gut inflammation already, you'll need to put that fire out to get better hormone balance.
Right.
One helps the other.
Yeah, great. Well, I have so many more questions I could ask you, but I think we covered the most important parts, but we are out of time. So let me just get to our signature questions for you. What are your 3 favorite supplements that you take?
I mentioned those already. Okay. I do love my enzymes, my milk thistle, and L-glutamine.
Okay, So you're everything that you give your patients, you're still taking as well. What are your favorite health practices to keep you healthy and balanced?
I have a lot of stress reduction techniques that I incorporate into my life, from journaling to tapping to hypnotherapy. I see a practitioner once in a while. That's a big one. I do love a good schedule, and I do need my day off a week, completely unplugging.
Yeah, and I find we didn't get into it as much today, but you did mention it a few times. But we know that stress reduction is just such an important part of lowering inflammation and such an important part of every protocol, whether it's for gut or hormones or anything else. And then last question for you, what is something that you've changed your mind about through all of your years in practice?
At least a few things, but two big ones were, do not do the killing phase of the pathogens until a client is ready. That's important, because original thought 15 years ago, we saw a pathogen that we would jump. Many, especially my clientele, Crohn's and colitis, were not ready for that. And the second, over the years, SIBO testing was exciting me when it just came out. And I don't feel that way whatsoever today.
Really? Wait, okay. Tell me more about that.
Well, the results are questionable. Treatment is questionable. You still have to go back to basics to address all the stuff before. And once you heal all the stuff before, methanoBacteria just balances itself out. Plus, there's so much more that can be done. Oxygenation. There's so much can be done without the supplementation for preventing or even going after SIBO. Over-treating SIBO now is a bigger problem than under-treating it. We are really like the antibiotics, or most of the supplementations are really harsh supplements or antibiotics, prescription items that are just taking out a good flora.
Do you find that some of the clients who come to you, they have been diagnosed with SIBO by someone?
Sometimes, yeah, very rarely. But now I hear gastroenterologists that taking that in, and they're testing for SIBO, and they're getting positives, and they're putting them on all these harsh antibiotics, and then it takes forever to get them back into balance. So I find it to be a catch-22.
Because a lot of times with the SIBO, it's like a symptom of something else, right? That's one of the schools of thought. And that's what you think? Yeah. Okay.
I also like to look at methanoBacteria numbers against the SIBO results, methanoBacteria numbers on the GI map. Because if that's not high, please redo SIBO results again. Let me be sure.
Okay. Interesting. I know we could have a whole topic on SIBO, but now I have to ask you another question. So when it comes to, say the Trio Smart test, which I like, right? Because it is a breath test and it is measuring hydrogen, methane, and hydrogen sulfide. I think the solution that's used is glucose, right? But you can also do it with lactulose. And do you think that sometimes the results are questionable because of the substrate that's used, but maybe it doesn't even matter?
It does matter. Plus, it's going to cause so much irritation for someone who's in distress already. It's not like it's a colonoscopy prep, that it's a upper GI. It's a small intestinal. There's a lot less room in the small intestine, so it will get stuck in there. It's tricky. Yeah, it's a whole conversation right there.
Interesting. Well, thank you for sharing your thoughts. I really appreciate it. Thank you for sharing your expertise with us. Where can people find more information about you?
So my website is digestivereset.com. That's where, if you're interested to become a client, that's where you go. If you're interested to become a student of my school, you go to melamedinstitute.health, and that's where you'll get more information on my school.
Wonderful. Well, thank you so much for being here today. Really appreciate you sharing everything with us. Thank you.
Thank you for being here.
And thank you for tuning into Conversations for Health today. Check out the show notes for resources from today's episode. Please share this podcast with your colleagues. Follow, rate, leave us a 5-star review wherever you listen or watch. And thank you for designing a well world with us.
This is Conversations for Health with Evelyn Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based, cutting-edge research, and practical tips.